Next up for you, Diana Lightfoot, Director of the NC Coalition of Healthcare Providers. She also served as Executive Vice President of the South Carolina Policy Council, Executive Director of the Alabama Policy Institute's Physician Resource Council, and the Pacific Region Manager of Consumer Relations for the Procter & Gamble Corporation in California. She holds a master's degree in psychology and community relations, a counseling license, and a teaching credential, and she's going to speak to us about something that's near and dear to all of our hearts and wallets, ObamaCare.
Apparently it isn't near and dear. I am so happy to be among friends. And as you can tell, I'm a little shaky. This has been a very emotional morning. In fact, I almost didn't come.
We love you, Diana!
Because already this morning, I heard from the person I love more than anybody in the world. And he is thousands of miles away in Afghanistan. And he is under attack. And so as I stand here, I don't know about his safety. And so you will forgive a mother's heart and the emotional way that I come to you today. But it is because of him. It is because of the things he stands for. Because of the things that he's willing to die for that I'm here. We can never forget that our freedom is maintained with a price. One of those freedoms has always been the ability to choose our health care. But that was before ObamaCare. No, our health care system isn't perfect, but we don't need to drop a $2 trillion bomb of Obamacare on the nation at the taxpayers' cost to fix it. To put even $1 trillion in perspective, 1 trillion seconds is 31,600 years. This country wasn't even in existence 1 trillion seconds ago. And yet that huge number, doubled, is what we are told it will take to fix our healthcare system. In terms of healthcare, America has two choices, and our choices are clear. We can have government-controlled healthcare or individually controlled healthcare. It all comes down to two things: freedom or enslavement. Enslavement is a very harsh word, but it's the truth. One famous leader said, "We may become poor as a result of our circumstances, but we remain poor by accepting the chains of eternal dependency." That was Winston Churchill. And so this is the choice America is now facing: to maintain our individual freedom and liberty that we fought and died for, or to accept further enslavement and dependence on government in whatever form that government chooses to impose upon us. With the unconstitutional imposition of health care reform, a Pandora's box has been opened. The health of a nation doesn't depend on big government. It depends instead on the health of the individual, on the family, on businesses, yes, even agencies and organizations. And government does play a role. But government's job is to unshackle business by reducing taxes, mandates, and regulations, and allowing us the freedom to make our own choices about how we spend our own money. Think about this. Does Washington choose your automobile insurance? Do they choose your cell phone plan? Do they choose the kind of automobile you drive? Of course not. Then why do they think they can choose our health care plans? And by the way, that's insurance or a health care plan none of them will ever use. The president tells us to trust him, that he will fix Medicare and Medicaid. But his plan involves European-style rationing, a model where 50-year-olds are told they are expendable. And that's just a nice word for you're not worth treating. From that age on, from now and into the future, if ObamaCare stands, your care, 50 is not old and up, will be dramatically reduced. But in order to achieve the care for others the government deems more important to society, this administration has cut Medicare by $716 billion. That's saving it. And this administration also tells us how 20 million uninsured people are going to now be cared for under Obamacare. But who is going to care for these people? Medicaid is bankrupt, and physicians can no longer afford to see Medicaid patients. The physician-patient relationship is suffering. I have worked with thousands of physicians across the nation for the past 15 years. And they tell me that not only is it suffering now, but it will suffer more under the socialist-style medical fiasco. Under the president's plan, rationing for the elderly and the vulnerable is guaranteed. Formulas will determine care for the patient, not the doctor-patient relationship, and people will die. And many will not be born. But, excuse me, the good news is there is a much better way. A better plan is to get the government out of the way and let the free market work. Competition drives costs up, costs down, and quality up with any product or service. As an independent, freedom-loving American, I want to make my own choices with my own money, not give it to a government who decides for me based on these formulas. Conservatives are often accused of not having compassion. Well, I'm compassionate. I volunteer in 4 different places. But I'm also realistic. The U.S. healthcare safety net for those in true need will always be there, as it should be. But at what cost? Shouldn't compassion also apply to the taxpayer? Millions of Americans receive some sort of government assistance, many for a decade or longer, and for many it's become generational. But when Mitt Romney points this out, he's attacked. I call this intolerance for the truth. Did you know that there are 187 separate welfare programs costing the taxpayer in this country $1 trillion a year, and that many of those 187 programs are duplicates of services already provided under Medicare, under Medicaid, or other assistance programs? That means that it's duplicating the cost to the taxpayer. As Paul Ryan says, any meaningful health care reform must include meaningful welfare reform. Because of these facts and others like them, we don't want Washington deciding how our health care dollars are spent. Sorry, Sandra Fluck, for $9 a month, the cost of 2 lattes, you could pay for your own contraceptives.
Yeah.
And no apologies to the pro-choice advocates who give no choices to those still waiting to be born, or to Oregon, where physician-assisted suicide has been legal for years, and where Barbara Wagner needed chemotherapy for her cancer, due to the cost to the state, and the fact that Barbara was the age of 62, they offered her physician-assisted death instead. It's past time to stop this inhumane madness masquerading as health or care. The truth is, no politician will save us. As with the revolution that gave us America, we must, with the guidance and help of God, rise to the occasion and save ourselves. Now is the time. Later will probably be too late. I'd like to dedicate what I've said today to that brave young man I spoke of earlier, who knows we're here because I promised him I would be here this morning. He knows we're supporting him and others there in harm's way by our prayer and by our action. And by the way, his name means little warrior. I promised him I'd do my part to vote for his health and his safety and our freedom. With my voice, with my mind, and with my actions. We can see the finish line, 40-something days, or is it really the starting line? And so I now ask that God allows us one more chance to maintain our freedom, to support our life and liberty, and to pursue happiness with every ounce of our collective strength. We must all refuse to give up on this, the greatest nation on the earth. Victory 2012 is not just a campaign slogan, it's a necessity. Thank you. Woo-hoo!